Hello, everyone. As this global crisis, COVID-19, rages on, I think we all see around us the various measures that are being taken by countries to, as far as possible, secure the safety, security, and well-being of their citizens. And quite close to us, we've seen just last night that Honduras has closed its borders. Uh, Canada has just announced that they will be closing their borders to all persons, but citizens and permanent residents. And there are other examples. Over the course of this weekend, starting on Friday actually, ministers have been meeting extensively with members of the private sector. We've had meetings with the Bankers Association, with the people from tourism, the hospitality industry, from the Chamber of Commerce, from Caribbean Utilities Company, Cayman Water Company, the Water Authority, the supermarkets and importers, Cayman Finance, the telecoms, and lastly with private doctors. Over the course of tomorrow, we will meet with the fuel suppliers, Sol and Rubis, and with the insurance providers. We have discussed extensively with all of these sectors of the economy and the community, not just their particular role, but more broadly the implications for the Cayman Islands. And we have discussed with them some of the measures that the government feels we ought to be taking. We've discussed things like food security, the certainty that we will have adequate fuel should other places around us that supply these things close down. And over the course of the next couple of press briefings, I plan to advise the country in more detail where we stand with respect to those various matters. But today, the principal subject that I want to talk about is the decision just taken by the cabinet just a few minutes ago to close the Owen Roberts International Airport and the Charles Colonel International Airport for international passenger flights for a temporary period of 3 weeks, beginning on Sunday, the 22nd of March, 2020, at 11:59 p.m. until Sunday, the 12th of April, 2020, at 11:59 p.m. Obviously, this time period will continue to be reviewed as this crisis and the nature of this crisis continues to evolve. For all destinations, with the exception of the United Kingdom, inbound flights from Thursday, the 19th of March, will operate for returning residents only. Outbound flights will operate as usual through Sunday, the 22nd of March. Flights emanating from the United Kingdom will operate as normal through Sunday, the 22nd of March. With immediate effect, any person arriving in the Cayman Islands will be required to isolate for a period of 14 days. Flights to Cayman Brac and Little Cayman will be restricted to essential needs and personnel and for residential travel only. Domestic flights between Owen Roberts International Airport and the Charles Colonel Airport and the Edward Borden Airfield in Little Cayman will continue. Cargo flights into the three airports will also continue. The airport will also remain open for any emergency flights, medevac, and courier and cargo services. The government has not taken this decision lightly, but we believe that it is in the best interests of the people of these islands that we do so. There will be some, no doubt, that will wonder why we have announced it now, but it doesn't take effect until Thursday. But we really do not want to have the scenes, the sort of scenes that I think all of us would have seen on television that occurred at Chicago O'Hare Airport in the last few days, where thousands of people are trying to get, in that case, to get into the country. In this case, it would be to get out of the country. We want an orderly evacuation to occur and to give all persons who are here who wish to leave the opportunity to do so. Anyone, as I've said before, who comes here on any flights as of this afternoon will be required to isolate for 14 days. The other matter I wish to talk about this afternoon, and as I said, as these briefings roll on, there will be many other issues that we need to discuss. But a big part of the discussion which the ministers have had with the business community over the course of this weekend has been about how they can help government to ease the burden and ease the challenge of loss of jobs, loss of income that we know many in this community are already suffering. The decision to close the cruise ports resulted immediately in the loss of income for more than 1,000 tour operators and taxi drivers. Many of those people have gone from making $300-400 a day to nothing today. So we have, in addition to what government is seeking to do itself, and those discussions are still underway and more announcements are to come. But we have asked the banks to consider payment holidays or the waiver of loan or mortgage payments. I am happy to say that they had already considered those things and were happy to make that commitment on the basis that they will be considered on a case-by-case basis. So if you have a loan or a mortgage and you are going to struggle to make those payments over the course of the next few months, please call your loan officer and seek to make the necessary arrangements. I can also say that we've had discussions with Caribbean Utilities Company and with Cayman Water Authority, and both have undertaken not to do any disconnections for the next 60 to 90 days. And both have said that persons who will struggle to make payments should come in, or, sorry, I should take that back. Please don't go in. If you can avoid going in, to contact the relevant officer within the respective companies to talk about making payment, developing a payment plan, or making other arrangements. And the final thing I want to emphasize this evening is the importance of isolation for persons who think they may have symptoms, persons who have arrived in the Cayman Islands over the course of the last 14 days. You owe it to your family, to your friends, and to the community. You have a moral obligation, if you think that you may have been exposed, to withdraw from community activities and to stay at home until a safe period has expired. The elderly among us, those who have underlying medical issues, those who have conditions like diabetes, heart issues, any issues affecting organs, are particularly vulnerable and at risk. The young, by and large, the young people among us will survive COVID many with little or no real symptoms. But those who are sick already, or those who are aged, are particularly vulnerable. And not isolating, in many instances, will be the same as imposing upon those people a death sentence. Please understand the seriousness of that. So we are encouraging everyone to be as responsible as you can possibly be during this very, very difficult and critical time. For the elderly and for people who have underlying medical conditions, the strong advice is for you to refrain from as much contact as you possibly can with anybody else in the community. Stay at home as far as that is possible. Expose yourself as little as possible to the risk of contracting this virus. I do not know if I can be any clearer than that. The greatest risks are to the vulnerable in this community, the elderly, and those who are already sick or have other medical conditions. We have a duty to protect them. A big part of the reason behind the restriction on travel to the sister islands is because we know that there are a lot of elderly people in Cayman Brac. It is in many respects a retirement community. And we want to restrict as far as possible the spread of the virus into that community, for it will have very tragic consequences. So I hope those messages are helpful to people in deciding how they go about their day-to-day behavior.
Thank you, Premier. I just want to add a number of points to that. I mean, as the Premier has already said as well, we are living in an unprecedented period. This is extraordinary in all our lifetimes, and government on Friday took some robust measures, and today there are more robust measures to help us contain this threat from COVID-19. And I support these measures fully, and I think they are exactly what is needed now to help us contain the threat and look after the welfare and well-being of people on these islands. I also want to just say that we have Public Health England here with us, a 3-person team. We've met them this morning. They're helping us and supporting us on testing, and that's a really big advantage for Cayman, that as of today we have the capacity and ability to test for COVID-19 on our islands, the only overseas territory that can do that. I'm sure Dr. Lee will say more on it. They're also helping us with the difficult situation at Health City to make sure we can get Health City back up and functioning as soon as possible. I just want to strongly support what the Premier said about isolation and self-isolation. We have the two groups of people, those on island who, if are showing any symptoms, whether it's coughing, fever, shortness of breath, they need to call the HSA hotline and they need to self-isolate. So stay at home, avoid travel, do not go to work or public areas, do not use public transport or taxis. Ask friends, family members or delivery services to carry out errands for you, and try to avoid visitors to your home. And then we have the category which we've just announced today of people coming into the islands from outside who will be asked to self-isolate for 14 days, as the Premier said. And I think it's really important to underline that government can do so much, and I think government is to its great credit doing a lot. But this is about all of us. It's about individual responsibility, and all of us have a responsibility to everybody on these islands. And what the Premier said about our elderly and vulnerable, however old we are, we all have a responsibility to follow basic hygiene, make sure we're frequently washing our hands. We all need to be doing that regularly. And we also have an obligation to self-isolate if we have any of those symptoms. So I really do want to underline that. I also just want to say very briefly, the civil service has also taken a number of actions regarding staff. So civil servants are able to work flexibly. We're encouraging civil servants to work from home. We are also giving civil servants this week discretion to be at home if they have childcare facilities. We are closing down some non-essential services, so library, museums, and we're redeploying some civil service staff to help us on these high priority issues around COVID-19. We've also taken the decision to bring forward the payment of salaries this month again to help staff. So I just wanted to say that. Finally, again, just to say that this is really important that all of us pull together and help everybody on the islands. We're still seeing some panic buying, and there is no reason for panic buying. We have no issues with supplies to the islands coming in by ship. We have the supermarkets have confirmed they have months and months of supply, so we really do want everybody just to be sensible and look after and think about everybody else as well. Thank you. Sorry, Minister.
Thank you, Governor. My fellow Caymanians and residents, as Minister of Health, it is my privilege to address you today. Firstly, I would like to take this opportunity to once again reaffirm that we continue to do everything possible to ensure the safety of you and your families, of the community and the Cayman Islands on a whole. The global threat of this novel coronavirus, COVID-19, is being grappled with across the world. Cabinet is making proactive decisions to ensure we minimize the impact of the virus in our beloved islands. The latest decisions taken by Cabinet include a ban on public gatherings of 50 people or more. This will also be reviewed depending on escalation. Although it excludes hospitals, pharmacies, and supermarkets, persons are still encouraged to keep adequate spacing of at least 6 feet apart and avoid as much possible peak gathering times where these are concerned. Travel restrictions on persons arriving from the areas as discussed of high-risk destinations are now in place, and cruise ships are blocked for the next 60 days, as already mentioned. In the light of these extraordinary times, I am pleased to see the spirit of Cayman kindness cannot be extinguished. Supermarkets have opened lanes to assist the elderly or disabled when they are shopping for provisions, and neighbors are helping each other. A call center manned by cadets is live today and should provide support to the HSA flu hotlines, as well as to concerned members of the community. The number again is 949-6555. I repeat that number, it's 949-6555. In addition, we all welcome the news that Cayman will begin local testing, as mentioned, for the COVID-19 today. Public Health England has told us they're pleased with our efforts, and the National Emergency Operations Centre has been meeting daily. Cabinet has approved funds so our medical practitioners have all supplies needed to combat the coronavirus. Government is taking this threat seriously. I can assure you every effort is being made to protect persons and to secure our shores. I understand the uncertain times we're in. However, I reiterate what His Excellency the Governor said, what he said last week. Please be responsible. Rumors and misinformation will not help us tackle the coronavirus. If necessary, we will use the law to tackle those who spread false rumors. Remember, you can check on www.gov.ky/coronavirus to see trusted and up-to-date guidance from the experts. This page is being continually updated and should become your first port of call for the facts. Please do your part to avoid scare tactics and fake news. Our preparedness work is comprehensive. While we ready our defenses, We are also aware that the global situation is changing on a daily basis. This government is not complacent. We will continue to prepare tirelessly, make the necessary decisions required in the best interests of the health and safety of our people. And we ask you, the people of the Cayman Islands, to engage with us alongside this fight. I understand if you may feel worried, scared, or stressed about the serious nature of COVID-19, but we can and will overcome this public threat. I encourage all to familiarize yourselves with the advice on home isolation so that any necessary preparations can be made ahead of time. And if the press wants more information on that, we can provide that also on home isolation. Please refer to, again, www.gov.ky/coronavirus for information in this regard. Again, remember to cover your cough and sneezes, wash your hands often, and avoid close contact with persons, especially if they're showing signs of respiratory illness. Please stay safe, and may God continue to bless the Cayman Islands. Thank you.
Good afternoon. I'd like to make no bones about my first point, which is the government is taking in all and every seriousness the magnitude and the severity of this matter, this threat of the COVID-19 disease upon these islands. This is evidenced by the energy and the amount of effort that's going into the decision-making, the support mechanisms, and the multi-agency working that is working behind the scenes in order to get the country prepared for this. Please be in absolutely no doubt about that. As far as the position that we're in at the moment is concerned, you may have heard the phrase delay, contain, and mitigate. We are through the delay phase because we now have COVID on the island, and so we're in the contain phase. But where we are between contain and mitigate is what we're trying to identify at the moment, and the only way we'll do that is with science and with figures. So we await the results, and we await to see the patterns of results in order that will drive our decision-making process going forward. The reason that will take us from contain to mitigate is when we have evidence of sustained community transmission of COVID in the community. And the longer that we can stay in the contain phase, which means isolating contacts, the more time it will have and the better we'll be able to face the threat. In addition to that, when we're in one phase, the contain or the mitigate, that also changes how we will make our decisions around testing for COVID. Because if we're in the contain phase, we will want to identify quickly and clearly all the cases that may exist. Whereas when we move into mitigate, as the United Kingdom now has done, you'll find that they're no longer doing any checks at the ports, and they are changing the information that they give to the public, and that will happen here as well. We will change the way we manage the condition, because when we reach that phase, we'll be saying we need a different tactic, and so it will change. Up to date, as you know, we have tested 5 people, and 1 has been positive. The 6th test there's been so much clamour about was not sent for testing because on review of the requirements for testing, it was not deemed to be a case. So that case, it was a non-case. Going through the testing rig at the moment at the Health Services Authority, there are 30 tests from Health City and 14 tests that have been received to the Health Services Authority labs from other people on Grand Cayman. And so we await those results. It is likely that they will be around probably tomorrow morning. They are working their way through the system at the moment. There are questions about the test kits and the numbers available. Test kits really relates to the reagents that are used to put through the PCR or polymerase chain reaction machine. Our first batch that came from PAHO had a supply of around 480 tests. But this afternoon in a conversation which Public Health England held with PAHO, we have been advised that we need to let them know how many kits will be required, an estimate, and they will be able to provide them for us. So it looks fairly straightforward to put in the next order for that. As far as Health City is concerned, the Governor mentioned two of the Public Health England staff experts, a consultant in microbiology and an expert in infection prevention and control, has been there to help guide Health City through the process of getting the organisation up and running. They met with staff in an administrative part of the hospital and did not pass through the hospital itself. The room had been cleaned, and they kept their distance according to the guidance that we all are aware of. The last area I wanted to talk about is really not only now in this particular pandemic, but also historically. It's been shown that the isolation, social distancing, and now, more modern times, we know hand washing is absolutely critical. We've all mentioned it across the panel today, and I want to reiterate it, but not only the science now, but also historically, it's been shown that this is what will help to reduce the transmission of infectious agents throughout the community. So even if you are a fit and healthy 20-year-old, protect the whole community, wash your hands, keep your distance, don't gather together, please. It seems that I think even the Premier was saying today, we're all becoming experts, but make sure that if you're receiving information, it is from trusted sources. You know where they are. We are still seeing falsehoods get out there, and they just need to be quashed and not read. And if they are read, not forwarded. Go back to your trusted sources and use those as your source of information.
If we have any questions from the media, I also have a slew of questions from the public that's coming in, but we can start with members of the media. Kevin, his hand up first.
Good afternoon, Kevin Morales with the Cayman Compass. Dr. Lee, I just want to confirm what you said, 30 to 40 tests, right? That have been samples that have been taken for testing?
30 have come from Health City and 14 through the systems of the HSA.
All right, 14. That's what I wanted to clarify. All right, thank you very much. And in terms of mortgages, we talked about. Sorry, Mr. Premier. We had talked about working with the banks to, I guess, make life a little bit easier for those who are paying mortgages. What about people who are renting? Is any sort of similar action being taken for renters?
Well, that is one that we're grappling with, but that's a very difficult thing, because there are many landlords, and there is no system of rent control in the Cayman Islands. So, with the banks, we can call in all of the bank representatives, and we can come to some sort of arrangement. Much more difficult with respect to landlords. So we're conscious of the issue. It's one with which we're still grappling, but I can't tell you now that we have an answer to that.
All right, thank you very much.
Ralph Lewis, Cayman Times. Mr. Premier, have you considered closing down the restaurants and bars, similar to what is done in some of the major U.S. states?
It is something that we've talked about, but Dr. Lee is far better able to talk about this than I am. But I have been paying very careful attention to all of these things. So we have adopted a very measured approach to what we are doing. We have at present, that may change when the results come in this evening, but no evidence of community transmission on which to base a decision that we should shut down, we should go into a greater state of lockdown than is currently the case. We are certainly going to review those things. If the results over the next few days indicate that there is significant evidence of significant community transmission, government will be taking some far more aggressive measures than we've done so far.
And as for other people on island who have medical issues that are not necessarily in line with COVID-19, but still feel the need to come into the hospital, what advice should be given to them? What do they need to do to seek out their medical advice?
Please forgive me, I cannot speak for the other healthcare providers on the island. However, if they call up their healthcare provider, I'm hoping they will give them the right advice about what to do. I think that a lot of the healthcare providers, and this is something that is very useful, both in the government sector and in the private sector, I've seen that telemedicine is now an approved thing, so and it is chargeable, so that for the time being, and it probably will not always be so, but for the time being, you should be able to hold a consultation through some telephonic or internet means with your usual provider, which will save everybody any risks that they may be concerned of.
And all elective surgeries and specialist services have been canceled. Would you be able to elaborate on that for me a little?
Yes, so what that means is anything that can be postponed. So if you wanted to have your if you were going to have your hip replaced, or if you're going to have a shoulder repair, but it's not a life-threatening matter, that will be something that will be rescheduled for a later date. But that's across the board. So anything, that's what elective means. So anything that is being done out of choice and agreement with the doctor and the patient will be put off into the future.
Okay, thank you.
Can I take a few questions, or pass a few questions from the public along, beginning with, with this one. There's going to be obviously an increase in demand on the internet systems in Cayman. What is being done to communicate with the telecoms company to ensure that they have the increased bandwidth that's necessary? Premier?
Well, we've had a meeting with the telecoms as well. And tomorrow or next day, I'll be able to make a much more comprehensive statement about where we are with that. But what I can say in answer to the question is that the telecoms are satisfied that they will be able to cope.
Okay. Another question from another member of the public. What's being done to monitor the churches? This person said that they actually witnessed 2 churches in 2 different districts with over 50 people on Sunday, while there were many others that were closed or doing their services online. So what's being done to monitor those?
Well, it's not just the churches. We had situations, reports from a number of people on whom I will rely, that there was some significant partying on 7 Mile Beach over the course of the weekend, all of these things notwithstanding. So the police are already stretched, but we will ask the Commissioner of Police to have the police patrol areas. We really would hope that people would behave much more responsibly, though. We shouldn't have to be insisting that people obey these rules, because this is about, as much as anything else, self-preservation.
Mm-hmm.
And
Okay.
if I could just add, this is about the rule of law, and this now is our law. So if people out there have information that those laws are not being obeyed, they should, in the normal way, report that to the police, and the police will take whatever action is necessary, whether it's a warning or advice. But as the Premier says, we really do want everybody to act responsibly.
Okay.
But I can say positively that I know many churches, and many of them had to really think careful about how they would do this. Some of them had services online. Some of them had 2 or 3 services for the day, so that they could comply. So I think the majority of people are doing the responsible thing. We just need everybody to cooperate.
I agree with that. I've contacted some of the pastors myself, and some of the information got out late on the weekend, so we'll give them the benefit of the doubt for this weekend. I can tell you that I went to a restaurant yesterday, and when I stepped into the door, they told me I was the 51st person. So they're getting the message.
Okay. Dr. Lee.
I just wanted to add to that, because just to explain the intent to reduce, to limit the gatherings is really about reducing the density. So if you've got a tiny little room and you squash 50 people into it, That is absolutely not the intent. The intent is that everybody should be able to be 3, preferably 6 foot away from the next person. And that's what I would hope to see if you're in church or in any other gathering place of less than 50 people. I would hope to see that spacing. I think even now, I've been seeing that the spacing in outdoor restaurants and things, I've been seeing that the tables have been moved further apart. That's absolutely the right thing to do to reduce the density.
Okay. 2 quick other questions from the public, and then we can move back to the media. One person wanted to say they can't buy personal hygiene products such as wipes and sanitizers or even alcohol, so how are they to follow the guidance, and when are more supplies of those things coming in? Do we know?
Well, I can tell you that I understood that. I mean, I can go ahead and say that Hurley's got new supplies in today, so maybe they should try. Not as that as a public endorsement.
Also,
Can I also add that
yes, sir.
you can wash your hands with regular soap and water.
Thank you, sir.
Just do it, for an extended period, 20 seconds, 30 seconds. It'll do the same thing.
And it's better for the environment too. So.
And
I
also,
think
if
people are
you
thinking just when they're mobile, they
Yeah.
don't have access to the soap and water, but the sanitizer. So.
and
Yes.
also if you have regular baby wipes, if you just add regular alcohol
Mm-hmm.
and pour it in it, it's a good sanitizer also.
Okay, the other question relates to work permit holders. How is this going to affect them with the borders being closed and a lot of them being laid off their jobs? This person wants to know, will they use the word deported, but that's not the word I think that fits in there. Should they have to leave if they have a work permit? Maybe not. If they're laid off and they can afford to live here, then what about that?
Well, let me say this. A decision as to whether or not they have a job is a matter for their employer.
Right.
If the employer cancels their work permit, they no longer have a right to remain in Cayman. If you don't have a job, we encourage you to leave.
Okay. Reshma.
Thank you. Reshma Raghunath, Cayman Compass. Premier, to build on the point that you just made, a lot of these employees that are being laid off may not have the finances to return. I know we had something that was called, I think, a work permit bond or something along those lines. Does that even still exist? How are these people going to leave the island if they are no longer employed?
Well, work permit holders leave Cayman every single day. They should use it by their own means. Their employer is supposed to ensure that they have a return ticket. If for one reason or another they don't leave, we do have a repatriation bond, but that is an extreme measure. People should leave under their own steam. They're just leaving earlier. If their work permit was up, they no longer had a job, they would leave in the usual way that thousands upon thousands of people leave every year.
So just to take us back to the flight changes and the border closing, can you just walk us through what that means? So if people haven't lost their jobs yet, but they lose their jobs next week, how can they get home? Just explain to us how the flight changes are going to work, the restrictions that you've imposed.
There are, as of, let me make sure I get it absolutely correct, as of 11:59 p.m. on Thursday, we will not accept anyone except returning residents. Up until 11:59 p.m. on Sunday, Sunday,
That's right.
22nd of March, people are able to leave. Because what we anticipate is that a number of carriers, not just Cayman Airways, will continue to fly to Cayman over the course of this week through to Sunday. Thereafter, the country will essentially be in lockdown for 3 weeks. Not for 3 months, for 3 weeks. So people who wish to leave should hustle to make arrangements to get out of here by Sunday, the 22nd of April. Otherwise, March. Otherwise, save in real emergency circumstances, they are going to have to remain here until the airport reopens.
You had pointed out a specific restriction for UK. Sorry, I'll hand it over in a little bit.
No.
How does this work? Are UK flights going to still operate? Just for clarity.
The reason why the BA is accepted from the other restriction or the date Thursday is because BA has scheduled flights still to Cayman for Thursday, Thursday, Saturday, and Sunday. The complication is that the BA flight on Thursday is booked solid. The other complicating factor is that as of Thursday, BA can no longer land passengers in the Bahamas. So we have, the number that I've been given is around 400 Caymanian students in the UK. And we have to ensure that they have the opportunity to get back home. So we are working with BA to make sure that is able to happen. Thereafter, the governor is working on, along with us, to create an air bridge between Cayman and the UK so that we are not completely shut off from that part of the world with respect to emergency personnel, medical supplies, whatever resources that we need. Not just for Cayman, but for the broader region, particularly the other UK overseas territories. But that would not be a commercial flight. There would be no passengers coming here for leisure. The only people who would be allowed in would be essential personnel. For example, if we had a breakdown in security, we lost a number of officers because they are sick with the virus, and we need to beef up our security, we would have that ability. The other the other thing I can say to assure residents here is that Cayman Airways is still very much alive and well, and we have an incredible resource in Cayman Airways which almost no other country in the region has. We have our own airline able to make emergency flights, able to do whatever we needed to do over this very challenging period.
Now, Premier, I just want to continue on that same line, and I'll give up the mic in a minute, but has government contemplated a bailout package for the tourism industry, for the workers who are on the breadline and who will be on the breadline given these restrictions? And is there any consideration being given to, say, opening up pensions so that people can have access to that, so that they can continue to sustain themselves for the next 3 to 4 weeks as we try to get this situation under control?
Well, let me say the government has considered all of those things, is still considering many of them. We've had, as I said, extensive meetings with the tourism industry. But one thing is absolutely clear. The Cayman Islands government cannot afford to underwrite the labor bill for the tourism industry. And we've made that absolutely clear to them. Our first and principal obligation is to look after Caymanians. And we just simply do not have the means to support hotels, restaurants, condominium projects by paying their labor bills over this period. Otherwise, the Cayman Islands government will be on its knees, and then we will all be in, as my father would say, a hell of a hobble.
Mr. Premier, oh, sorry, Don, is that okay?
No, go ahead.
Going back to what we talked about before with mortgages, in your discussions with the banks about measures for, I guess, mortgage forgiveness, Did they indicate that doing that would cause any financial issues for them, and would that be even a bigger concern?
No, not at all. I think the banks are all in very good shape, and what we're talking about is deferred payments. It's not forgiveness. It's a payment holiday, or whatever you want to call it, or a waiver of the payment, so you don't have to make that payment. But of course, you're still accruing interest, although interest rates are now going to be much lower than they were before this. If there's a silver lining to the average person from all of this, it's that. But I forgot to mention Reshma's answer. The other part of Reshma's question was a bit about pension payments. So the government is looking at that, and of course that would apply not just to Caymanians, but to anybody who is contributing to pensions. Those sorts of things will require some form of legislative action, but also we need to look at the implications of people tapping into their pensions in the overall picture. So we're having that work done now, and we hope to be able to be in a position in the next week or so to make some judgments about how we go with that. I know that many employers who are, because the hotel industry has, the tourism industry has just absolutely collapsed. The manager of as an example, the manager of the Ritz-Carlton said to us in the meeting that Saturday before last, he was at 100% occupancy. By last Saturday when he spoke to us, that is the day before yesterday, they were at below 50%. And it's just in free fall. So by Thursday, I think whether the airport is closed or not, you wouldn't have many tourists continuing to come here. And this is not just true of Cayman, this is true of all over the world. People are just stopping traveling.
And Mr. Premier, right off of that point, actually, we've had several people write to us today saying that they've had to cancel their vacations. Several of them have pointed to the fact that they haven't been able to, I guess, get a refund from their hotel or resort or their Airbnb, et cetera. Is there any sort of policy that government has, or is there, I guess, maybe any advice that you might give the manager at the Ritz or people in that sort of position when it comes to refunding people who have had to cancel their trips?
Well, yeah, I've had people write to me directly, believe it or not. They get my email, they write me directly. My strong advice to the hospitality industry is to refund those deposits. This crisis will not last forever. We want that business to return to Cayman. We want people to feel good about the Cayman Islands and the way we treat people. That's what Cayman Kind is about. Refund the deposits.
Okay, Premier McLaughlin, or maybe Dr. Lee can answer this question. Seeing as the Cayman Islands has the only overseas territories testing facility, is it being considered to offer services of testing to the other overseas territories?
Well, it's actually, it's a question that came up. I mean, obviously, we have to satisfy the needs here in Cayman, and there is the logistical aspect of how you get tests from other overseas territories. But I think it's something we absolutely want to look at, and in certain limited circumstances, if we can, I'm sure we will try and help with that.
Okay. Also, the financial services, Premier McLaughlin, if you could speak to this, and the robust preparations for business continuity. Are you able to speak to that?
Yes, we went with thank you for reminding me. That was one of the other things I was supposed to talk about, but this is all happening so fast that I don't often get a chance to prepare any written speech. I just got to go from my memory. But yes, we had extensive discussions with Cayman Finance, and a lot of them being safe. Talked to us on a conference call. Mm-hmm. We're on a conference call for a couple of hours. The financial services industry is in really, really good shape, and many of them have already sent their staff home and are working with just a skeleton staff in the office. Mm-hmm. and people are able to work remotely on these. I have to say that all areas of the industry have absolutely supported the measures that the government has put in place, and I think collectively we are all of the view that if Cayman can come through this with minimal loss of life and without too many people becoming sick and certainly not having the sort of meltdowns that we're seeing in other parts of the world, when the crisis is over, we will be very well placed to get back into the business faster than most other places. And that's what we're aiming to do. Financial services is even more important now than ever it was, because the tourism industry, at least for the time being, has collapsed. And so we need to ensure that they stay healthy and they stay strong and continue to provide business, perhaps I shouldn't say as usual, but business as unusual.
Another question from someone from Cayman BRAC that wants to know why they won't be able to go home and visit the BRAC after a certain period.
If you are a resident on the BRAC, you're able to go.
Okay.
The reason for the restriction, as I said before, is that if you are down here in Cayman, if we do have community transmission here, and you are here, and you contract it, but don't know and are asymptomatic, and go to the BRAC and spread it there, you're going to kill hundreds of BRACers, because it is an retirement community where there are a lot of elderly people who have the usual chronic illnesses that come along with advanced age. It's as simple as that.
Okay. Reshma, go ahead.
Okay, thank you, Donna. This one is for Minister Seymour. You spoke to us about getting supplies, ventilators, those kinds of equipment that we would need as the situation progresses. Can you give us an update on those supplies and the quantities that we have purchased?
I don't have the quantities here, but I know that this is a collaborative effort, and we have Health City and also Doctors Hospital that also have ventilators, whose will remain a part of the pool. We have ordered more ventilators. I can get that and provide that for you, the amount of ventilators.
Sorry, Minister Seymour's not privy to the information that I was given only about half an hour ago, in that as far as the ventilators are concerned, they're on their way, but we haven't even yet got the tracking number. So that's, I believe from the HSA, it's 4 ventilators that are on their way, which is much faster than we had thought. So we're pleased about that.
All right, Dr. Lee, since you're on the camera, I might as well ask you this question, because this one is going to be directed to you. Can you provide us with an update on the patient, the COVID patient's wife who is in isolation at Health City right now? Do you have any, what's her condition, what's the status with her?
I don't think it would really be appropriate for me to do so, because we know who that person is, so that would not be appropriate. In general terms, as far as Health City is concerned, I haven't had any specific concerns raised. I'm very pleased to know that the people who were the staff members are all improving, so that's good news.
Any more questions?
One final question. This relates to national security. In particular, the Premier mentioned police and getting involved with keeping the situation under control in terms of the 50 persons ban. Where does the regiment lie in this? Governor Roper, I think maybe you can answer this one, because that was part of why we were getting the regiment prepared. So can you provide us with an update on the status of the regiment and how do they factor into our own response?
Yeah, no, I think, I mean, clearly in the medium term, the regiment would have been extremely useful for exactly this type of situation if we did have a security need on the island. But even though that the regiment is slowly building itself up, it can still play a role. We have the officers trained, and we do know there are people on the islands who have military background and military experience, so I think we will quite quickly be able to move forward. Today we've actually got 3 of the officers working down in hazard management, supporting hazard management as extra resource. This is what I meant by redeploying people to higher priority tasks. So absolutely, this is exactly what a regiment can help on, and even though we're only just at the beginning, we'll make sure we do whatever we can to make use of it.
Just a couple of questions for you, Dr. Lee. How is the test given? Where is the testing being done? And how long does it take to get the result?
So the test that we are using is a nasopharyngeal swab. So it's not quite a cotton bud, but if you imagine a cotton bud, it's similar to that on a longer stick, and it's put in the nose. That's the nasopharynx to take a sample. The sample then goes to the laboratory for processing. That processing will take somewhere between 24 and 36 hours to have the result.
Okay, thank you. And another question. We've seen in other places, like in the UK, certain shops like Iceland have created a designated hour just for elderly people to come in to shop. Is that something that could potentially ever be enforced here? Because the elderly are so vulnerable, including people who have a compromised health system already. Maybe it's not best for them to do their shopping amongst the rest of the general public. Could a specific hour be made specifically for them to get their groceries, also away from all the ridiculous panic buying?
Well, there's an idea that I don't think we had considered, but the supermarkets themselves have concerns about this and about the sheer number of people that are mobbing the supermarkets at one time. Some of them have created special lanes for the elderly. I know, I hate the name call, but I know Hurleys are working hard on getting people to order by online.
Yeah, and they have a
Online.
delivery service.
And I think I know they're in discussions with the other supermarkets about how they can help them get to that place as well. So we have incredibly modern and sophisticated supermarkets. I mean, in line with the best anywhere in the world. And clearly the management of those businesses really understand the threat and are working very, very hard to minimize the threat and to make it more convenient for everyone, really, to be able to get access to the supplies they need without having to expose themselves any more than you absolutely have to. But we're not there yet.
If I could have the Honorable Minister Seymour talk a little bit about providing some more information on isolation.
Thank you, Donna. What I also want to mention is the Cayman Islands Red Cross had a dues placard that you see moving around on WhatsApp, asking people to take paracetamol, which is considered Tylenol, Calpol, or Panadol. This is what's recommended. Also, in terms of self-isolation or isolation in itself, we're asking people to stay at home, remain in your home except for medical supplies or care. Do not go to work, school, or public areas. Do not use buses or public transport or taxis. Separate yourself from other people in your home. Stay in a ventilated room with a window to outside that can be open, separate from everyone else. Call ahead before going to the doctor. Wear a face mask if in isolation. When in a room with others visiting, also visiting the doctor. Avoid sharing household items. Do not share dishes, glasses, cups, eating utensils, towels, or beddings. All waste that has been in contact with the individual, tissues, masks, should be tied in a plastic bag, and do not put it out until the person is cleared and does not have COVID-19. And always remember to wash your hands often with soap and water.
Okay, thank you for that, Minister Seymour. Reshma?
Thank you. My final question. I think this one is very important. We talked about the commercial flights. We talked about the domestic air bridge. We haven't talked about private flights, private jets. We haven't talked about private jets. We haven't talked about private jets that are coming into the island. Can you tell us, are they being equally screened? Will they be? 1, 2, 3.
Repeat. You can
All right,
repeat
I'll
the
start
question.
over. In terms of private jets, we've talked about the commercial flights. What sort of process is in place for those flights? Are they not going to be allowed in as well? Or what's the screening like for them when they come into the islands as well?
So that particular segment is referred to as general aviation, and they will be subject to exactly the same rules as the commercial flights. So unless they are residents here, they will be prohibited from landing as at Thursday of this week. And they're subject to the same self-isolation rules as apply to persons who arrive on commercial aircraft.
Premier McLaughlin? Okay, last question.
Thanks so much again, guys, for your time. We're getting a lot of questions about if there is going to be more unemployment, even if it's temporarily or over a short term. People are concerned about an increase in crime. I'm wondering if any measures are being taken with the police to, I guess, maybe put those fears to rest, or just make sure that we don't see an uptick in crime.
I mean, I absolutely understand that question, and it is something that we are thinking actively about and discussing sort of contingency planning and arrangements with the Commissioner of Police. So absolutely, yes, it is something that's been taken into account.
I'd like to ask a quick question that came in several times regarding NAU and assistance for persons. Premier, could you speak to that?
Yes. Well, what I would ask people, if they don't mind, is if I could hold that question really until tomorrow or the next day,
Absolutely.
when I will have a comprehensive response.
Okay.
What I can say generally is that absolutely we're gearing up NAU to be able to deal with what we expect to be increased applications for assistance. But I can speak in more particular terms tomorrow, I hope, because we have a fairly significant decision to make when we go back into meeting at 4 o'clock about how we propose to help with that. Because we know there are going to be many people that are going to need many Caymanians are going to need significant assistance to get through. We don't know quite how long.
Okay. Any final words from the panelists before we wrap up?
Well, I think I just conclude by saying is that we are very encouraged by the response of the community to the measures government has taken. Quite frankly, I went into some of those meetings with great trepidation. Some of the measures that we have put in place are fairly radical, but we have had complete support from all sectors of the community. The measures we're taking to try to keep ourselves as safe and healthy as possible. That is a wonderful feeling. I tell you, to when you go out in the community, people say, yes, it's hard, but short-term pain for long-term gain. I think it's the tagline we want to attach to the measures that we are putting in place. I am also very encouraged by the sort of assessment that Public Health England has made about our level of preparation and the measures that we are taking. And the view is, and I'll let Dr. Lee have the final word on this, or the governor, whichever, the view is that we are in a very, very good place in terms of preparation, in a better place than most countries in the world at this stage in terms of our ability to deal with this threat.
Yeah, I mean, I just second that and say again that, you know, we have excellent health professionals and facilities on the island. And as the Premier said, Public Health England believe that the testing capacity, which is already being developed before this COVID-19 came on the scene, that is a huge advantage for our islands. So we are in the best shape we can be in, but there's a lot of different ways this can go, and we have to be very prepared.
Dr. Lee, Minister Seymour, any final words?
Good, thank you.
Stay safe.
All right, and with that, we'll end this here on CIG Television. We thank you, our viewers and listeners, and of course the media for being here with us. And we'll be back here tomorrow, hopefully at the same time, with more of an update on the coronavirus as it impacts the Cayman Islands.